name is Diwakar Kinra, and I'm an endodontist practicing in Flint, Michigan. I would like to take a few minutes to discuss a maxillary central incisor that was referred to my office for endodontic treatment. The patient was a 65-year-old female with a chief complaint of, "I have a bump on my gum." Upon review of her medical and dental history, a clinical exam was initiated. At initial glance, this case may seem straightforward, but let's look at some of the nuances that may be challenging throughout treatment. To help us increase our success rates and decrease our procedural errors, I devised a checklist that I use in every endodontic case, inconsequential of its perceived complexity. Checklists can be used for an array of tasks, from the simple grocery checklist that makes sure we don't forget items as we pass through the aisles, to as vital as a pre-flight checklist that makes sure our airplanes are safe to fly across the world. Here we will use it to make sure that we carefully progress through the procedure in a meticulous manner. These are the items that need to be taken into consideration on every case to make sure we are thorough in our therapy. In this video segment, we are going to review the first 4 items on the checklist. Let's tackle the first 2, case selection and diagnosis. Before we decide to take on this case, we should make sure that it can be performed in our office safely, thoroughly, and efficiently. As we can see in this case, the main canal either furcates or has a large lateral canal approximately 3/4 of the way to the apex. Also, when examining the radiographic lesion, we notice it is not centered over the apex of the root, which leads me to believe that there is more than one portal of exit for the canal. Since I always keep the end in mind, this makes me fast forward to the irrigation obturation phase of treatment, knowing that I will need 3-dimensional disinfection and thermoplastic obturation to complete the case. Now that we have decided to take on this case, we will need a pulpal and periapical diagnosis. Upon oral exam and clinical testing, we noted these symptoms: pain to percussion, buccal swelling, and no response to cold or hot. So we came up with a pulpal diagnosis of necrotic pulp and a periapical diagnosis of symptomatic chronic apical periodontitis. Now that we have a diagnosis, we can proceed with the next 2 items on our checklist: local anesthetic and rubber dam isolation. Anesthesia is one of the most feared aspects of any dental procedure. Providing comfortable and profound anesthesia is the first step in starting off the root canal on the right foot. I make sure that I test each case after providing anesthesia with the application of endo ice on the tooth in question. If there's no thermal response, then I'm confident that we have achieved profound anesthesia and are ready to proceed. Before initiating treatment, I always start with single tooth isolation of the tooth undergoing root canal therapy. This will decrease contamination while making us more efficient and the case more successful. You can see before we use a stepwise protocol before actually initiating treatment, this allows for a smooth transition into accessing the tooth.